Kenya Red Cross Society experienced remarkable positive growth in programming in the year 2012, further propelling it forward in the goal of moving to greater achievements in all project implementation objectives countrywide. The year also saw the Kenya Red Cross Society enter the second year of implementation of its balanced scorecard. Most of the set project targets were achieved, with the society reaching out to the beneficiaries through services in disaster management, health, nutrition, water and sanitation, refugee operations and the Global Fund Round 10 amongst other programs.
Congratulations. We even give you the keys, you can go in and start.
Furthermore, the society also shifted some of its programs from disaster response to disaster risk reduction by working in the most vulnerable areas in the country to pilot long-term food security initiatives.
Sisi wakati tulipewa hizi shamba hatukuamini ya kwamba hii shamba itafaulu. Hii miradi tumetengenezewa ni ya kutusaidia.
The society undertook projects geared toward livelihood support based on farming initiatives that included shifting further from food aid to food production, with a surplus for income generation.
This one is in a river, along the river, they can be out of food aid. They shouldn't be on food aid. And I want to actually challenge this community here in the whole of Madogo division and and Sala. The challenge is on them also to get away from the syndrome of dependency. Because with these farmers now, they should not be asking for free food. From what they have got, what they're able to sell, yes, we have to work with them to improve on markets and such things, but they should be out of food handout. They shouldn't be asking for free things anymore.
A key achievement under the Kenyans for Kenya Drought Initiative was the successful transformation of 60 acres of dry desert land in Walda Moyale into fertile farming land that saw a bumper harvest of kale, watermelons, buttercups and capsicum, popularly known as Pili Pili Hoho. Furthermore, in Kaikor, Turkana North District, the society commenced the sinking of boreholes, installation of net houses as well as drip irrigation and greenhouses. The construction of Chesimiron Dam in East Pokot with a capacity of at least 321 million liters of water also commenced.
And here in East Pokot, it was agreed that we would build a very large dam that would be able to hold water for the communities, be able to store water over the long term, and eventually be used for integrated food security projects around agriculture and also supporting livestock security as a whole. Today the dam has officially been opened. We're awaiting the rainy season to come and fill the dam. It has a capacity of over 312 million liters of water, so it will hold a very large amount of water. We're told that it will be able to irrigate farms over 8 months, whether or not there is rainfall over that time period. So it's really one of those long-term transformative projects that we really intended Kenyans for Kenya to support and implement.
I am very happy to note that from now henceforth, issues of relief will be a thing of the past. We know for sure, like when there was hunger, children and mothers suffer quite a lot. And for now, they are going to have to breathe a sigh of relief now that there will be food across in the divisions and in the constituency. We know for sure that the Red Cross for a long time has been reacting to situations. But now we are very happy that there has been an innovation where they do long-term projects and especially integrated irrigation.
As part of early action through the Disaster Response Program, the Kenya Red Cross Society was able to support school feeding programs and general relief distribution in many parts of the country. The society has also been able to purchase and distribute drought-resistant seeds targeting vulnerable farmers in lower eastern, coast and northeastern regions.
So the local people, the local communities are the ones who own these projects. They are the ones who've got to make it a success. And let's just see this kind of project spread across northern Kenya. There's no reason why it shouldn't happen.
Tulikuwa na mifugo na hizo mifugo ikaisha, na sasa tukaanza kutengeneza kampuni ya kutengeneza shamba. Tukaweka mashamba sasa kukua mzuri, mashida ikatoka sasa. Ndizi sasa iko sawa, sasa ile mashida zote zikatolewa.
Tupigeni
The Health and Social Services Department prioritizes the need for integrated programming to ensure a holistic approach to alleviating human suffering. Furthermore, in line with the Kenya Red Cross Society strategy, the department seeks to contribute to the reduction of morbidity and mortality resulting from communicable and non-communicable diseases amongst most vulnerable people. The year 2012 was one of some key accomplishments for the department, as it saw targeted community members being empowered and thus responsible for their own health.
To what they've helped me, help my community in this area. Very many people in this area have accepted themselves. Normally when we go for home visits, the community doesn't know my status. So if you have a case in the village, they call upon me to go and talk to the person who's low.
Working closely with the strategic partners under the leadership of the Ministry of Health, the department was able to significantly contribute to provision of accessible, equitable, and affordable community-based healthcare. A focus on curative, preventive, promotive, and rehabilitative healthcare has also been woven into the health projects.
Part of the harm reduction program, I think it also encompasses the needle exchange program, since there's that danger of you becoming an addict and also become HIV positive, I think those are two crosses to carry, and they're not easy. So this time around, I can take care of myself and I can be there for somebody else, and that's what I'm doing up to now.
Additionally, the overall goal of the blood safety program is to contribute to the collection of adequate and safe blood for transfusion across Kenya. The program was also very strategic in forming partnerships with like-minded organizations such as the Kenya Blood Transfusion Services as well as non-state actors. Key achievements included an increase in services, provision of human resource support to branches and regions, thus enhancing operational capacity. The overall goal of the HIV and AIDS program is to contribute to the reduction of HIV-related morbidity and mortality and mitigate the socio-economic impact among the vulnerable populations in Kenya. The program successfully integrated family health and home-based care, hence taking basic care closer to clients.
Siku hiyo nilikuwa nyumbani na nilikuwa mgonjwa sana. Sasa sikuwa najikubali ati mimi ni HIV. Sasa nilipopelekwa hospitali nikapimwa, nikaambiwa, lakini nikawaambia wasiambie mama yangu. Sasa tena vile niliporudishwa hospitali ndio nilikubali kuambia mama yangu. Tangu siku hiyo mpaka saa hii wamenifanyia vitu vizuri sana, nimejua mpaka nimeendelea, hata watoto nimewapata wakiwa negative.
The capacity of community health workers and peer educators were also strengthened.
We also conduct HIV counseling and testing during the same setups, whereby we have mobile tents and we have a mobile VCT setup.
In addition, the program also successfully supported orphans and vulnerable children.
Since my childhood, life has not been going so easy, as in sometimes there were times that food was not enough. There were some times that we missed, as in people missed a meal in the family, and everything is a big problem. At times you would even think doing suicide was much more better, for life was not even doing any good to you. But I had a steady heart, knowing that one time, something good will come out of this life. That's when the Kenya Red Cross assisted my mother with some capital. She started up a new business, held my shoulder up and my head up high, because I know everything will come in place. For starting the capital, Mom now has a new business. She's thriving in the business and the business is doing well. Now she has a source of income. We are eating a basic diet. We have access to proper health facilities. Everything is now going smoothly.
Kenya Red Cross Society implemented projects in Isiolo under the IHOP Outreach Project, as well as disease prevention and control projects.
hatuna maternity, mahali ya kuzalia, hata hatuna pia hospitali. Hata tukikuwa na shida, hatuna mahali pa kwenda, tunakaa tu hapa paka watu wa Red Cross wakuje.
Kofi Annan, the former United Nations Secretary General, once said, "We shall not finally defeat AIDS, tuberculosis, malaria or any other infectious disease that plague the developing world until we have also won the battle for safe drinking water, sanitation and basic health care." Programming in the Water and Sanitation Department is continually realigning itself to address emerging themes in order to increase the value and sustainability of our development efforts. This has mainly been through a paradigm shift from standalone water and sanitation projects to integrated programming in disaster risk reduction, preventive health, and harnessing food security. The department has implemented water, sanitation and hygiene projects co-funded by a number of strategic partners this year.
One of the things that triggered this project here was that in 2008 and 2009 there was a very severe cholera outbreak in this area, and that's how we came in. And then we mobilized resources from the Netherlands government. We found the partnership with the Red Cross in order to implement this project so that we can provide water to the population. Already here we are covering about 7,600 people.
The fruits of this have been improvement of access to safe water, basic sanitation and hygiene practices for rural pastoralist communities in Isiolo, Lobolo in Turkana Central, Garbatula, Samburu East and Merti districts. The Kenya Red Cross continued to successfully provide humanitarian assistance at the IFO2 Dadaab refugee camp. The refugees' operations also saw the completion of a maternity hospital, improved health and sanitation, state-of-the-art planning and camp layout, as well as increased ambulance services. The Organizational Development Department continues to strengthen the capacity of the regions and branches to handle internal and external functioning and strategic relationships. The department's main achievement was aligning the organizational structure following the adoption of the current Kenyan Constitution, which provides for devolved county governments. The society further embarked on adjusting its structures in order to tap into opportunities and resources that will arise in new counties. In line with our strong national representation and through the 8 regional offices, 63 branches and 70,000 volunteers, the year also saw the successful introduction of the annual Volunteer Awards. The awards were aimed at recognizing and motivating volunteers, individuals and institutions that have supported the Kenya Red Cross.
So, during the year under review, there was a major focus on strengthening our volunteer management systems. The key focus during this area was really in realization of the fact that we needed to align our volunteers in order to be able to achieve our strategy that we had planned for 2011 to 2015. To ensure internally that we have a better record of our volunteering, we developed an online volunteer and membership database. This provides a framework within which volunteers can, any prospective individuals, Kenyans or non-Kenyans that wish to volunteer with the Kenya Red Cross Society, they sign up online. When they sign up, they give their contact details, and then from the branches, from the regions, from the headquarters, we are able to see all the people that are willing at any particular time to volunteer for Kenya Red Cross Society. We get back to them, we talk to them, we find out their areas of interest, we match their areas of interest onto our work, and where we expect them to be, we call them back.
This year, Kenya Red Cross became the first national society with a disaster reduction department to focus and implement an urban risk reduction program, especially after the floods and mudslides that have affected urban settlements over the years. Another point of evidence strengthening the gradual expansion from disaster response to disaster risk reduction in efforts to bolster more resilient communities. In combination, in the recent past, emergencies and disasters tend to grow rather than wane. The Society, through its Emergency Operations Center, continued to respond to disasters across the country that included conflicts, road traffic accidents, mudslides, collapsed buildings, fires and medical interventions, amongst others. At least 1,478 responses were coordinated.
For us then, we are looking forward to continuing in the response area in 2013, but more importantly looking at working in the devolved system of government and therefore working closely with the county governments that we are also auxiliary to.
The Society, through its broad network, also carried out a national peace campaign built towards preaching peace before, during and after the March 4th, 2013 general elections. The campaign, that was popularly known as Kumbuka 2008, Choose Peace, was targeted at reaching 10 million Kenyans to pledge peace during, before and after the 2013 elections.
In October then we decided also to start a peace campaign, dubbed Chagua Amani, because from the beginning of the year we realized that tensions were rising, and knowing that 2013 was going to be the election year, based on the experiences of the past years, for example in 1997, 2002 and the latest 2007, we knew that it was time to come in and begin this to be able then to avert any possible crisis.
Building partnership goes a long way in resource mobilization, as well as nurturing relations. In 2012, the Kenya Red Cross partnered with like-minded organizations for Kili Climb 2.
Into a collaborative effort between NMG and Kenya Red Cross to build awareness around immediate humanitarian and development issues facing the country. This initiative has also incorporated the participation of various organizations in scaling Mount Kilimanjaro, as well as in fundraising for the beneficiary projects.
A project that saw staff from 4 organizations climb Mount Kilimanjaro to raise funds for the Loitoktok water catchment area. More partners came on board with livelihood projects that included greenhouses and water projects. Through this support, the Society has installed more than 500 greenhouses across the country. This has seen communities and educational institutions improve their food supplements as well as augment income-generating activities.
This Red Cross imetusaidia sana na mimea ya tomatoes. Tunaendelea na kupata manufacture yake na inatusaidia kwa kuuza na kupata pesa. Kama mwanafunzi ninafurahia kwa maana hii pesa tunapeleka katika akaunti ya shule yetu ya Tisekuru Primary School.
Another major milestone was broadening the foundation to strengthen the institutional resilience and sustainability through activities such as of opening of the Boma Nairobi.
Say congratulations to them and continue to give help to them, because the fact that they are getting that far shows we have put our money into a thing which is worth growing. Profits from this hotel are intended to supplement the society's income and fund human activities.
An increased subscription of the E-Plus ambulance services that also saw more ambulances being pre-positioned in the regions with the support of a robust supply chain department in place. The Society's humanitarian work also received recognition from external organizations. with the society winning awards in road safety campaigns, governance awards, and once again, the super brand status. The Red Court Hotel, now known as the Boma Inn Nairobi, also scooped the KABA Awards from the Kenya Institute of Management. And the newly opened Boma Nairobi was also voted as the best hotel in Nairobi by Travel Advisor, beating 87 other hotels. All in all, 2012 was an eventful and productive year in which most, if not all, of the Kenya Red Cross Society's ambitious annual targets were met. We are grateful to all partners for helping us make it a successful year for the institution and aim to build on the gains of the year to continuously serve those in need, living up to our value proposition of always there.
Ni kwamba wakati umefika. Tumekuwa uhuru kwa miaka zaidi karibu 50. Ni wakati wa sisi wenyewe sasa kujitegemea.
I just wanna let you know everything will be alright. I just wanna let you know everything will be okay. Cause I got your back, siendi kokote. Cause I got your back, siendi popote. Cause I got your back, siendi kokote. Siendi popote.